Hello, I'm Dr. David Furman, the Medical Director for the Hypertrophic Cardiomyopathy Program at Corewell Health, which is the new name for Spectrum Health in Grand Rapids, Michigan. We want to thank you for the opportunity to participate in HCMA Awareness Day. It is my pleasure to share some highlights about our program and introduce our awesome team. Our clinic was founded in 2013 and became an HCMA Center of Excellence in 2017. We were the last stop for Lisa Sahlberg prior to her heart transplant, so she likes to say we broke her heart. We offer a comprehensive, patient-centered approach to diagnosis, education, and treatment. We bring our resources around our patients wherever possible, which includes coordinating consultations in our HCM clinic with an electrophysiologist, genetic counselor, pharmacist, and social worker as needed. We facilitate family screening of our HCM patients along with our pediatric cardiology clinic. Our echocardiography lab offers multiple regional locations to allow patients to remain in their community for much of their testing. Our approach has also evolved during the COVID-19 pandemic to include virtual provider visits and genetic counseling. Our more advanced services include cardiac MRI, catheterization, and electrophysiology labs, all available at Meyer Heart Center. Our multidisciplinary team includes 3 physicians, myself, Dr. Jeff Decker, and Dr. Richard McNamara. We work alongside physician assistant Lori Singer-Schiraldi and our nurses Sue Philpott and Paula Droste. Electrophysiologists Dr. Alfred Albano and Dr. Najib Chalfoun, cardiac surgeon Dr. Tomas Timic, pediatric cardiologist Dr. Stanley Sidor, genetic counselor Bethany Grisco, and social workers Doreen McGrath and Justin Joseph round out our team. Our clinic follows 939 HCM patients, and in 2022 we saw 155 new patients. Dr. Timic performed 14 septomyectomies last year. One of these patients, a 32-year-old male, had a septomyectomy and a mitral valve mobilization. He's doing fantastic, the best he's ever felt. He's walking several miles and even running with his children. Perhaps the most exciting development for our patients was our involvement in the groundbreaking clinical trials for mavacamten, including Explorer HCM, MAVA LTE, and Valor HCM, in which several of our patients were enrolled. Now that mavacamten, or Camzyos, is FDA approved, we have several patients whose quality of life has been dramatically improved by this first-of-its-kind medication. We are continuing our involvement in clinical trials of both mavacamten and aficamten for patients with both obstructive and non-obstructive HCM. One of our favorite patient stories is a patient we followed for many years with obstructive HCM. She was an avid traveler and even climbed the steps of Machu Picchu and hiked in Sicily. After a Caribbean cruise, she began to not feel well with an increase in shortness of breath. With worsening symptoms, her active lifestyle was quickly curtailed. She entered the Valor HCM trial in November of 2020. She is now feeling fantastic and has been willing to share her experience with other patients. Referrals to the clinic can be faxed to 616-885-5411 or by calling the office at 616-885-5000 and asking for one of the HCM nurses. It has been a pleasure to collaborate with the HCMA over the years, working together to improve the quality of life for hypertrophic cardiomyopathy patients. Thank you.